Hi, thank you, Debbie. Yeah.
Here's okay, yeah. Great.
Yeah, okay. Thank you, Debbie, and thank you very much, Michelle, for your very informative presentation. There's a lot I can contribute to what you would say there tonight. Anyway, I had a lifetime of bleeding. As a child, I had just severe nosebleeds and leading to eye infections, terrible eye infections. And that went on then to infections with my teeth. I was known as the delicate child in the family. Nobody else had all these bleeds, only me. And one thing led to the next, the nosebleeds, and then the abscess in my teeth, then teeth extractions. And the bleeding would then 2 days after having, I wouldn't bleed straight away after having the tooth extracted, it would about 2 days later, and then infection setting in. And I remember at 8 years of age having 6 teeth removed. I'm talking about now going back to the 50s. I'm a lot older than everybody else here listening in tonight, I think. So like having the gums stitched 2 or 3 days after the extractions and still bleeding. That was my story right into my teens. And then in my teens, I started with the periods, and they would last up to 10, 12 days. Now, I thought that was the norm, didn't discuss it with anybody, presumed that was the norm until in my 20s that I moved to the city and in college and that sort of thing, and talking to friends. And like they'd be just 2 or 3 days. Then I was saying, what's going on here? Went to the GP and, oh, that was fine, been giving me something or other. At the time, the thing to take for pain and all that was anodine, which didn't actually help the bleeding. But I had a GP at one stage when I was about 23, and his solution for my hemorrhaging was to have a baby, that would solve the problem. You know, so anyway, that didn't happen. Yeah, the periods continued, and that was it. The teeth, I lost most of my teeth because of infection, root canal infections, because of the heavy bleeding and, you know, a vicious circle. I got married, and then I had 2 boys, and, you know, it was bliss when I was pregnant, absolute bliss, because I had no bleeding. And even after, I didn't have any hemorrhaging after the pregnancy for about 2-3 months, and then it would be like deluge again. I had to try and solve the problem after my first baby. After 6 months, it was suggested I have a womb repair, because there was some damage to my womb. I had a womb repair surgery, had a bleed, had infection. It took about 4 to 5 weeks before the wound healed. Then after that, then I had another baby, and that was fine. And when he was about, I had very heavy bleeding again, the same story, back and forth, different doctors, on to gynecologists. And eventually, I think to solve the problem, at 35, they decided I had to have a hysterectomy. It was the one way to solve it. So I had a hysterectomy at 35, and I was in hospital, and a week after the hysterectomy, I got hemorrhage again. Didn't know where it was coming from. Had to have surgery again, and I got infection. And I spent 2.5 months in hospital. And it was after that, then they decided, you know, something has to be done here. And I was sent for a test, and that was in 1983, and I was diagnosed with Willebrand then. But like, the only advice I got then was that if you're having surgery again, you will have to have treatment, and you can only take paracetamol. So that was the only advice I got. And it was 1996 then, before the haemophilia had a seminar in Cork for women with bleeding disease. And that was the day that my life began, really, because there was a representative there from St. James's, and met them, and they invited me to St. James's. And from there on, for dentists and for the treatment I've had since then has been absolutely wonderful. Wonderful, I must say. And even though I had the ups and downs in between, you know, I would say that the one advice I would say, even having a diagnosis, like if you're going for surgery, you need to have a very definite plan. I did have surgery 10, 12 years ago, and there wasn't a definite plan in place. And I did get a bleed with a second surgery, and I'd got a very bad infection, and I had skin graft and lost part of the skin graft. Now that only happened 12 years ago, you know, but even after that, then it was followed up, and I now have a very definite plan in place. Now I still do suffer from nosebleeds, and I get them, but I just have to watch diet and anything with vitamin E in it. If I have, I can't touch fresh pineapples. I can't touch, as I found out 2 years ago, cranberries. I got a kidney infection, and of course, drink cranberry juice. Oh my God, I get such a nosebleed. It would just burst, you know. So I have to watch for supplements and anything that has vitamin E in it. I just cannot have anything with vitamin E in it. I will get a very severe nosebleed. But apart from that, like I still would get bruising and that, but I would take cyclocarpran, and that's basically it. Like I would say, like things have improved immensely, really, I suppose, in the last 10, 12 years. You know, it's people, our doctors are more aware of it, and I would still be a little bit apprehensive, let's say, going to a new doctor, a new consultant, you know, for investigating something or other, because I still feel, you know, are they going to take me on? Are they going to say, look, you know, because that was my experience. Like dentists actually over the years closed the door on me. They said, no, we don't want to treat you again, because when I get out the tooth, I had infection, I was bleeding, and the answer was, no, we would prefer not to treat you again. I could nearly list about 10 dentists that said no to me over the years, you know. But what that's important, I think, to say as well now is looking good dental care. It's very important, and you know, looking after your teeth and having regular dentist visits for people with von Willebrand's. And I think it's important to have a dentist that's understanding and well informed, because some healthcare workers really can be dismissive. When you say I von Willebrand's, they say, all right, yeah, okay, and carry on. But like when you're sitting the other end of the table and they say that to you, you feel, you know, here I go again. You know, you have to explain, and you have to fight for yourself, and you have to stand up to get the proper treatment. But I must say things have really improved. And Michelle, with your talk there tonight, I think things are really, really looking up, and there's a lot of support there.